Any disease, including colorectal cancer, is a combination of the environment, and sometimes one might think that your diet plays a role in colorectal cancer, as well as patient predisposition to the disease, in this case cancer. And that means genetics. And so the disease is the consequence of the environment and the genetics put together. But the genetics is different between two patients who might have the same disease. And this touches upon the concept of personalized medicine. In other words, because of the individual genetics that are different in two people, the same disease might behave differently in those two people, and explains why, in some way, some patients do well and some patients don't do so well. We frequently will test both the patient and the tumor for its individual genetics in order to then make decisions about treatment, and that's again personalized medicine. That treatment relates to chemotherapy choice, but it also relates to surgical choice. Frequently we will make decisions surgically based upon those genetic tests. So it plays a great role and an increasing role in regards to the management of colorectal cancer. The research into this area is very, very exciting, and the Institute for Personalized Medicine at Penn State Hershey Medical Center is part of the research process where nearly all patients who come to the medical center donate DNA in order to then be evaluated for genetic predisposition to disease. As well as that, we have a biobank that looks at the basic science of disease in patients with colorectal cancer using genetic evaluations.